If you are experiencing pain, you might need a root canal. A root canal is an attempt to save a tooth which would otherwise require an extraction. Root canals have a bad reputation for being very painful, but the reality is that they are usually no more painful than getting a filling. In most cases, a root canal is required when the nerve or pulp of a tooth has become damaged, infected, or if a dental abscess is present. Infections can cause discomfort and swelling and may require an antibiotic. Should you choose to go ahead with the root canal treatment, you will likely need to start an antibiotic before we can schedule your appointment. Ideally, a root canal is booked within 2 weeks of starting your antibiotic course. This will help reduce your infection and help decrease the likelihood of reinfection. Our dentists are general dentists. They are able to perform many root canal treatments easily right here in our office. There are, however, dental specialists called endodontists who are experts at root canal therapy. Root canal treatments done in a general dental clinic like ours are considered a basic service and are covered by most insurance plans. Depending on the tooth and the number of canals, they can range from $500 to $1,000. Services performed by an endodontist are considered specialist fees and as such are not always covered by insurance plans. Additionally, most specialist offices do not accept assignment of benefits and require payment in full at the time of service. The good news is that in most cases, root canal treatments can be completed right here in our office. There are circumstances where our dentist may attempt a pulpectomy, the cursory removal of the nerve and infection, to get you out of pain. The goal is to complete the root canal in our clinic. However, there are situations that can arise beyond the dentist and patient control that require a referral to an endodontist. In other cases, especially complicated cases, cases with unique tooth anatomy, and those requiring a retreatment, it is in our patient's best interest to be referred to an endodontist. Patients may also prefer to see a specialist for their endodontic care. No matter what your situation, our team will give you all the information you need to make an informed decision regarding your treatment and direct you on how to proceed. First, the dentist will use a local anesthetic to numb the area. Please note that if you are severely infected, you may not freeze entirely. This is why starting an antibiotic course prior to your root canal treatment is so important. Next, the dentist will use a rubber dam to isolate the tooth and keep the working area dry and sterile. The dentist will then use a drill to open and clean the affected tooth. A series of files are used to clean out the infection all the way to the tips of the roots. A cleaning solution is used to irrigate the tooth and take away any remaining infection. Once the canals are clear, an X-ray is taken to confirm that the entire root is cleared of infection. The dentist then uses a malleable filling material called gutta perca to fill in the canals to protect and strengthen the root structure. Sometimes a post is added to the material to offer additional support for the final restoration. The tooth is then sealed with a permanent filling or sealed with filling and prepared for a crown. In most cases, a crown is recommended to help protect the root canal treated tooth. Crowns are at an additional cost and usually require more appointments to complete. Sometimes, more than one appointment is required to complete the root canal. This can happen for a number of reasons, including the number of canals, severe infection requiring drainage, calcification of canals, or difficult access due to tooth anatomy. Our team does everything possible to ensure a positive outcome for our patients. However, there are some complications that can occur, whether in our office or with an endodontist, which may affect the final outcome of treatment. Before deciding on how to proceed, please be aware of the following. Sometimes, root canals can cause post-operative discomfort lasting for a few hours to a few days that may require pain medication. This is not uncommon and can usually be controlled with over-the-counter medication like Tylenol or Advil. If your discomfort persists longer than a few days, please let us know. There may be post-operative swelling of the surrounding gum tissues or facial areas that may require additional antibiotics or prescription pain control medication. The dentist will give you a prescription before you leave if you require one. Should your discomfort last more than a few days, please let us know. Because of the anatomy or state of your tooth, dental files used in the removal of the nerve may break inside your root. The dentist may remove broken files if it is safe to do so, or leave them behind if removing them may put the tooth at further risk. A broken file will cause no harm to your tooth. You may opt to have the file removed surgically, however, if unsuccessful, it can result in the loss of the tooth. Because root canals require exact precision in very difficult positions, a perforation or puncture of the tooth or root may occur. A perforation may require surgical corrections or extraction. It is possible that an existing or new fracture of the tooth or filling may occur during treatment. Your tooth may require a new restoration, or if the tooth is beyond repair, it may need to be removed. You may experience complications associated with the administration of local anesthetics. The same type of anesthetic is used for fillings, so if you haven't had a problem before, it is unlikely you would have one during a root canal. Some complications include allergic reactions, fainting, heart palpitations, or bruising. Finally, you may experience short or long-term tenderness or soreness related to the TMJ. Please keep in mind, if your dentist recommends a root canal, it is a final attempt to save the tooth. Root canal outcomes are not guaranteed and are impacted by many influences beyond our control. They have a success rate of 85 to 95%, and if properly cared for, including proper restoration and regular dental care, they can last a lifetime. If you decide not to go forward with a root canal treatment, the alternative is to have the tooth extracted. Should you choose to remove the tooth, there are many options available to fill in the space. Please talk to our dental team to find out which options would be best for you. We are here to help. No matter what course of treatment you decide on, we are with you every step of the way. If you have any questions regarding your treatment, please ask one of our team members.